Did you know that stretching your low back spasm is one of the worst things you should do if you're having spasms within your lower back? Hey guys, I'm Dr. Josh. Today's episode is going to be all about treating low back pain, especially if you're having spasms. And I'm going to share with you some of the top things that my patients have gotten results from when it comes to lower back pain and spasms. These spasms can be extremely uncomfortable and it can be very sharp and stabbing like pain, especially with particular movements. So we are going to show you how and why some people get some results and what you can do to start getting yourself results right away and feeling a lot more comfortable. So before you even get started, it's really important to know that when it comes to lower back pain and spasms, typically these muscles start to really tighten up around the spine, especially in one or two particular movements. So for example, if it hurts to bend down, your body might lock up and it might not allow you to do that. It may not also allow you to twist or turn a certain direction, and you might feel like it's more spazzing on one side than the other. Typically it's in the QL area or in this area, and it can feel like a pull down into the glute or even up into this mid to lower thoracic area. It can be very uncomfortable, especially if this goes on for days and you really have to get back to work or some sort of thing. So it's really important to note that if you're having these spasms, the body is trying to contract these muscles to protect itself. It is a natural protective mechanism to help itself from further injury. So think about it. If you have the spinal cord, if you have a nerve, it's better to contract these muscles than to pinch the nerve or pinch the spinal cord or irritate any of these sensitive structures. So just knowing that right away, you're going to want to figure out what makes you more comfortable and do more of that, and what triggers your pain and do less of that. So for example, if it hurts to bend down and it hurts to rotate to the right, it's going to be in your best interest to avoid those movements and let the body calm down a little bit and relax a little bit and let the muscles relax a little bit. One of the most common things that most patients also ask me is, should I do heat or should I do ice? Generally speaking, if you're just having some spasms and some tightness within the lower back and the muscles, it's usually best to use about 10 minutes of heat. But if you hurt your back acutely, meaning you fell, maybe you strained it doing some sort of yard work, picking up something off the ground, picking up your kid, and you're feeling some sciatica or numbness or tingling going down to the leg, it's probably better that you're going to use ice. There are some people out there that will do better with ice or do better with heat. It really just depends on you and your condition. But at the end of the day, heat or ice can make you feel more comfortable in the short term, and that is totally okay. But you're going to want to also do not just heat or ice or passive modalities. You're going to want to do some more active movements. So one of the easiest ways to completely relax your low back pain spasms is to just relax your low back in general. So we can do this on a bench. You could do this on a chair. You could do this on a bed, assuming it's too high or too low. It has to work for you, right? So what we can do is grab this box. We're gonna get into our 90-90 position. So we're gonna place our legs up here and we're going to lay our back here. And we can completely relax. We're not trying to lift our hips up. We're not trying to do anything special here. We're just letting our back relax, and we're gonna focus on our relaxation. You can put a pillow behind your head, and then from this position, all you're going to do is let your back hang out here. For some people, you may want to stay here for 2 minutes and then come off, and then repeat that and add up to approximately 5 to 10 minutes per day until the spasms go away. So that is one way, and that is the 90-90 position. It's very effective, and it's sometimes what we call the relief pain position or the back pain relief position. So again, it doesn't have to be perfect with 90-90. This would be more like 90-90. The more flexion you get, so a higher stool would be better. But if you don't have that and you have something smaller, or you have a bunch of towels or a couch, this might be the only way. And also, it's really important to note that if you have a solid, hard ground, it's better to use that than to have a soft bed or a soft couch. So again, soft bed or soft couch is a no-no. Hard surface is better, and keep your feet up into 90 position if possible. So while you're in the 90-90 position, you may also want to do a decompression stretch. So what we can do here is we can get back to our 90-90 position, and we can place our hands onto our hips and we can scoop. So what I'm doing is I'm not just pushing my hips and pelvis down, but I'm pushing and scooping up. So I'm kind of placing my hands in my pockets, so to speak, and I'm pulling or rolling up. And I can feel just a gentle, I'm not really super pushing, I'm just pushing enough where I can feel a little bit pressure, and it's like a very nice decompression. You can hold that for 10 seconds and then release and relax. Then you can go back in, release and relax. And you could do many, many sets of this, maybe 5 or 10 sets. It should be very mild and should be very, very comfortable. And you could do this in this type of position. And with very minimal effort, you can feel a lot of decompression, and you should feel it on both sides, because basically what you're doing is you're pulling down the pelvis and you're separating the surfaces by laying onto your back and decompressing your spine. One simple and easy way to get some gentle movement and some rotation side to side in the spine is to do some windshield wipers. So you'll lay down onto a hard surface onto your back and you'll move your legs side to side. I think a lot of people here try to get too much range of motion. They try to go all the way over and their hips fly up. All you need to do is just get slight movement. Again, if you're having a lot of spasms, we want to just create a little bit of movement that generates a little bit of heat, a little bit of comfort within the spine, within the body, without straining it. You're already having a ton of pain, so just move your legs side to side early in the morning, middle, afternoon, and try to get some relief within the spine. Again, a little bit goes a long way, and it's just about finding some comfort and relieving a little bit of that discomfort day in and day out, and then before you know it, you'll feel a lot better just by getting some gentle movement within the spine. Another simple and easy exercise that you can do is to lay on the ground and place your knees down and do diaphragmatic breathing. If you're very unfamiliar with diaphragmatic breathing, it could be a very long process, but basically what you're doing is you're learning how to breathe and expand and contract from your belly, okay? We don't wanna do chest breathing. We wanna focus on slow, deep breaths in and out. And the reason this is so effective is, one, neurologically, it calms down the body. Two, the diaphragm is actually part of our core musculature. And so when you get up and you walk and do some of these activities, you're really generating some core activation within not only the diaphragm, but the abdominal wall, as well as its integration with the hip. So just getting some diaphragmatic breathing or some gentle inhalation and exhalation with some core activity can not only help with your breath and dive down that nervous system, but it can really, really help decrease your pain. So when you get up, you can actually feel a lot better. Again, very slow, very gentle, and you can do this for 1 to 2 minutes at a time. You can do this seated, you can do this standing, but it's definitely best advised that if you're having a lot of pain, to start on your back on a surface that's flat and hard, so that this way you can also get the actual focus to the abdominal wall and not have to focus on like your spinal position or creating more spasms in a bad position. Finally, one of my favorite exercises that I do for a lot of pain relief, and this is also really good for spasms, is to do McKenzie extensions. And in many times when people have a lot of spasms, it is really, really not advised to do a lot of press-ups. So what that looks like is this. But if you're having a lot of spasms, you may want to just put a heat pack here and just hang out. And you might just be this high, you might be lower here, you might be here. It doesn't really matter how high you are on this position. It really matters about what feels comforting for you. And you may just want to hang out here for 30 seconds. And then after 30 seconds, place your head down and then come back in. Heck, even after 30 seconds, you may even give yourself a roll to keep your spine nice and straight. And then when you're ready to go back into it, slowly and gently, you can come here and you can hang out. You can even place an ice pack or a hot pack on your low back in this position. Of course, make sure you do so safely, but this is something that you can do multiple times a day. And I find that a lot of patients find a lot of relief with all of these exercises in addition to the other things that we've talked about. As a bonus, it's really important to note that if you're not hydrated, it is really important to make sure you're hydrated, not just with water, but with minerals. And I do really recommend that patients get a lot of electrolytes within them. I personally use LMNT, Element, and it is by no way sponsored in this video, but I just want to let you know that it is a great supplement because one, it is sugar-free, and two, it has the right ratios of minerals to go into the cell. That being said, this week alone, I saw 2 patients who were having back spasms, and we found out that after 1 or 2 weeks of just adding some hydration packs and some, electrolytes to their recovery sessions, they were doing significantly better. Yes, there were some mechanical issues going on, but also they admitted to me that they just basically wake up, they chug a little bit of coffee, they have a little bit of water, and that's basically the only water that they have in the entire day, and they're on their feet doing construction all day. So again, this is super important. It's probably not the entire cause of your pain, but it may help reduce some pain and discomfort. In addition, if it's not the primary cause of your spasms or anything like that, even just having spasms in general, having some more electrolytes in there can really help soothe the tissues that are being affected as well. Either way, it's a win-win, and you're preventing yourself from, one, being dehydrated, mineral deficiencies, and two, if you are having mineral deficiencies and it is causing spasms, this can really help to improve that as well. So if you found this video helpful, make sure you download our free low back pain guide. This guide has all of our top exercises in addition to some of the things that you should avoid when it comes to low back pain. So make sure you download our guide, and if you found this video helpful, make sure you subscribe to our channel so we can see you for the next episode.